I'm Jim Check. You're watching Now Media. With me, Gavin Dew, MLA for Kelowna. And you guys just had that town hall. And we were supposed to go there last year, and we had some medical stuff come up with some of our staff, so we couldn't make that event, but I hear it went very well.
Yeah, it was a great event, Jim. We had more than 100 people there, from doctors to nurses to people that have had experiences in the healthcare system. It was very emotional. We had some tears, we had some frustration, we had some anger, but I was really heartened by the courage and the hope that was in the room as well.
And that was the three of you that put that on, the Kelowna MLAs here in the area here. That was Christina Lowe and Macklin McCall and yourself that kind of put that event together.
That's right, Jim.
Yeah. And then just recently, you and I have talked a few times now on this issue here with Interior Health. Susan Brown has resigned now, in a way, I guess. She's stepping back and they're looking for they got an interim CEO in place now. Is that enough for you guys now, or is there more? Because you and I talked, how deep does the rot go, and does the rot go up or down? Where is that at?
Yeah, that's a really good question, Jim. I think that Susan Brown's departure, as long as it did take, ultimately was the right decision, but to me it was only the beginning. No organization depends only on one person. It's crucially important that Interior Health gets turned around, and a big part of that is clearly that there's been a breakdown in culture, a breakdown in communications, and a breakdown in trust between the corporate and clinical sides of the operation, particularly from a leadership level. So I think it was important that Susan Brown did exit, because that does create room for a reset in the relationship and for a new direction under new leadership. But again, I think that really is just the beginning of the process of resetting the organization and establishing a new and more functional culture that allows all of the good, hardworking, smart people in the organization who want to make it better to be able to contribute their ideas and to feel as if their efforts to improve things are happening because of, rather than in spite of, leadership.
That letter that was leaked recently too, that 2022 letter from the Okanagan mayors there, is that the smoking gun that puts more of the attention right on the BC NDP? Because what was done about that communication obviously is a big part of this problem. Communication with the doctors, communication with the nurses, and then, obviously the CEO, I guess, is the one responsible in this area. But does that letter point the finger at the health ministry and the BC NDP government?
Well, sure, Jim. Just to take a step back and tell folks what the letter was. More than a year and a half ago, or what was it, two and a half years ago? 2022, a group of 5 mayors in the area wrote a letter to Adrian Dix, then the Minister of Health. And what they said was that there were major problems in communications with Interior Health. They, as mayors, were unable to get information, were unable to get engagement, and they directly called on Adrian Dix, who was then the Minister of Health, to remove and replace the CEO of Interior Health in order to reset that relationship. So years ago, the Minister of Health was hearing loud and clear that there was a breakdown in communications and that the problem appeared to be at a leadership level, and he did nothing. As far as I'm aware, there was not even an acknowledgement of that letter. There was no meetings that came out of the letter. There was no action that came out of the letter. So what really concerns me, Jim, is that, yes, we've had one incremental change in terms of one leader in the organization has left. Yes, that is important because it symbolically turns the page for all those people in the organization. But it really feels as if there is and has been a bunker mentality at the top levels of the organization that started with the former Minister of Health, that appears to continue with the current Minister of Health, Josie Osborne, who finally set foot in Kelowna General Hospital 224 days into her time as Minister of Health. It appears as if there is a bunker mentality from the board or the board chair of Interior Health, who seems to think that nothing was wrong, everything was fine, that there was no issue whatsoever. And clearly there was a bunker mentality in that senior executive team. I've heard that time and time again from people that have worked in the system, from local leaders who have tried to interact with the system, that there was a really impenetrable bunker mentality that seemed to treat all efforts at engagement and all efforts at constructive criticism as being a rebellion. Or as being what was described as a physician revolt in one internal email that I was told about. They seem to treat it as though anyone offering criticism, constructive criticism, offering ideas was out for their heads rather than doing what they should be doing, which is working to make the system better. So that has to be reset. There has to be a new culture, a new level of communication, and there have to be really loud, clear signals to all of those folks working in the hospital, especially to clinical leaders on the medical side of the equation, that things have changed, their voices will be heard again, they will be listened to again, and that they can actually offer constructive criticism and expect that it will be taken up and used to make the system better, rather than expecting that there will be retaliation or that they'll be marginalized for offering criticism, as has happened, and frankly, and as happened as recently as this Monday, when Minister Josie Osborne finally came to town, finally visited the hospital, and doctors who have been critical were apparently deliberately excluded from meetings with her.
Yeah, this does open the door, though, the parting of Susan Brown, the CEO here. I guess it opens up a door, at least, and that's what you guys were saying, is that not necessarily all the blame rests with her, but if she's already retiring, it doesn't give us a path forward, and this opens a door. But and I look to the Ministry of Health there because of that letter, and we got a 7-minute interview. We were granted a 7-minute interview, and we did ask the question on the letter, and we got kind of a roundabout answer, which was a non-answer. And it seems like they refuse to be held accountable as to what's going on. And this health crisis, obviously, you're in the BC government there, but it doesn't seem just to be limited to here in the Okanagan Interior Health, but Fraser Health Authority. There seems to be a more of a systemic kind of like crisis in healthcare. And I think one of your colleagues, Dr. Anna Keddy, is her name? Kendi, yeah. She had a piece that went out today too, talking about it seems like the NDP is running out of money and ideas for healthcare here.
Yeah, it's clear that there is a serious crisis in healthcare that goes beyond Kelowna General Hospital, beyond Interior Health, and throughout the province. I think we've really become, in some ways, the canary in the coal mine in terms of seeing how dysfunctional it is, but also in terms of inspiring frontline healthcare professionals in other parts of the province to speak out. And I think, we're getting a lot of inbound email, a lot of phone calls, a lot of anonymous tips from people who are telling us just how broken the system is. And I think that it is shocking and unprecedented that we've gotten to the point here in Kelowna that doctors have been speaking out in a way you never would have seen them do before, that you've seen just this outpouring of frustration. And again, what I think is so striking about it is that especially early on in this crisis, or in the visibility of a crisis that really has been ongoing for years, we kept getting this message from Interior Health and from the Ministry of Health that these issues should be shared, quote unquote, through the appropriate channels. As in, these issues should be shared internally and that they should not be aired to the public. Well, what I've heard time and again from those frontline workers is that they've given up on the internal channels, on the quote unquote appropriate channels, because they were getting no action. And in fact, they were worried that if they raised their voices internally, they would have their privileges removed, they would be punished, they would be rebuked, they would be marginalized by a very bunkered culture. So going back to your point, I do think it's crucially important that we see culture change as we get a new leader in for Interior Health. I have, frankly, limited confidence that we're going to see the right new CEO hired if the same thinking that hired Susan Brown and defended Susan Brown to the end is actually controlling the hiring process. Some of the comments, frankly, that I've heard from the chair of Interior Health have left me seriously doubting that the board is fully aware of just how much change is needed. I don't think that we're going to succeed in seeing a turnaround of this organization unless there is real change at the top, unless there is a new leader with a fresh perspective, with an open mind, and with the ability to engage with people on the clinical side with credibility and with an open mind. And I really want to make sure we get a great new CEO in place. I remain to be convinced that we are on track to that happening right now, based on some of the very bunker mentality comments that I've heard in recent days out of the leadership level of the board.
I think it's really key that point you brought up about doctors finding, I guess the willingness and the courage to speak up, because we did see the doctor in the Fraser Health Authority getting punished for speaking out. And, when I watched that first young doctor, Dr. Hannah, I can't remember her last name now, when she spoke out on TikTok, I thought, oh boy, she's going to get it. But then she was supported by that letter. I think it was 7 doctors that sent the letter out, I think the following day. And then it was followed up with about 136, I think, healthcare professionals signed that letter. So it became almost like, okay, so now is our time to speak up, instead of one person putting their hand up and getting it, like chopped off or whacked down. All of a sudden, like doctors and nurses are finding their strength to speak out into a system that they're disgruntled with.
Yeah, Jim, I mean, there's strength in numbers, and that's what we've tried to accomplish. Really, at the end of the day, this isn't my story to tell. This is the story of the people that are struggling in the front lines of the system, and this is the story of the people that are relying on the system. What we've been able to do as MLAs is to amplify those voices and to try to bring people together and to galvanize that voice for change, to make sure that people can be in a room or can see themselves reflected in the media and know and understand that we have their back. Because again, that fear of punishment, those precedents of punishment and marginalization that we've seen in the system have really suppressed the ability of frontline clinical leaders to be able to flag these issues that are huge, dangerous situations in our system. So I've said privately and I've said publicly that we will have these people's back, right? If leadership at Interior Health, if leadership in the Ministry of Health, if leadership in the Premier's office think that they're going to get away with trying to suppress or marginalize or punish people for speaking up, I want them to know that we will be there fighting for them, and we will make damn sure that they are defended. We cannot have this culture that just tamps people down and prevents them from being able to contribute constructively to improvements in the system. And that, again, I really want to stress that coming out of our town hall, what we saw was the courage of doctors who have never stood up publicly before, talking about the challenges that they face. We also saw constructiveness, we saw optimism, we saw hope, we saw people talking about how to actually fix the system. Those kinds of conversations are exactly what should be happening within the system. My hope is that we get a new CEO in Interior Health who is able to inspire that kind of constructive, open, evidence-based conversation among the people that work in that system, where they can acknowledge what is and is not working. They can be truthful about the evidence base, about the numbers, about the challenges, and they can work together in order to improve the system. Because for me as an MLA, for me as somebody in the legislature, I can't wade into the tactical details of what needs to happen in the system. All I can do is try to be a voice for change and a voice for a culture change and a leadership change that creates the enabling conditions where the people working in the system can have confidence that they're being heard as they try to make it better for the people that rely on the system and for all the thousands of people that work there.
So you guys held that town hall, and that was again Christina Lowe and Macklin McCall and yourself. You gave a platform to these people to air their concerns with Interior Health, and we're going to play a small clip here from that event here. If you could run that clip here.
Kelowna talking about the healthcare crisis. More than 100 people came out to share their stories, their feedback, and their ideas on how to make our healthcare system better.
I have seen firsthand a lot of different scenarios in the hospitals that sometimes the public's unaware of, and those are the issues that are coming up here tonight.
Well, I think the system has been progressively broken for a long time. I think it's reaching a critical point. You're getting enough momentum that people are recognizing the time to speak out and the importance of it.
Yeah, and I think what we're learning here is that a lot of people feel censored, they feel muzzled, and we're finding the power and the health in coming together as a society and discussing the topics.
Well, you can see that we only have half of what we should have for pediatrics. We don't have a pediatric ward, and we don't have pediatricians who can see children in the emergency room. So if your child needs to be admitted to the hospital, that won't happen at Kelowna General Hospital now. This is an unprecedented situation, and we do not know of anything similar that has ever happened in British Columbia, where a major hospital has lost such a key component of its services.
Yes, and it's very clear from the passion we saw in the room today, just how many doctors and nurses, technicians, all kinds of healthcare workers how important it is to make sure that their patients are put first.
Currently, there's 700,000 people in BC that do not have a family doctor. We have emergency rooms closing left, right, and center. You have doctors speaking out in Surrey, Abbotsford, all across the province. And it's just something that needs to be addressed now, because if we don't do it now, I mean, it's just going to continue to get worse.
When it comes to care, we all want the best level of care, and we want to take care of all of our people. So I think it's time that the NDP takes this more seriously and does something about it.
We're so thankful for all the great people that were here tonight. And I think what we really concluded with was a sense of optimism and hope that if we work together, if we keep on pushing for positive change, and if we acknowledge the great work that's being done by so many fantastic people in our healthcare system, we can keep the pressure up and get this thing done and make our healthcare system work again.
Right, during that clip, obviously a successful event there for you guys to give people a chance to speak, and you had some doctors there as well.
Yeah, I was really struck by it. I mean, we've seen such an outpouring of engagement with this subject. Obviously, more than 100 people there last night, but I would say we've been on the news every day about this. This has been the top most read story on a number of different local news outlets. And I think, again, we're leading a provincial conversation. What I want to stress that I think is really important is, look, yes, we're politicians. There is politics involved in this. Our job is to be critical of the government. But what we want, and what everyone that I've talked to wants, is to make the system work again, to make it better, to make sure that people working in the system who want to be there, who want to be engaged, who want to be part of the solution, are empowered to do that. So much of the commentary that I've tried to offer over the course of the last month or 6 weeks as this has been playing out has been really just being paint by the numbers, organizational turnaround and crisis management. It's been pointing out that you can't turn around an organization on your way out the door. It's been pointing out the importance of leaders showing up and engaging with people in the organizations that they lead in an unfiltered, respectful way that gives them the opportunity to share their feedback. And it's been making sure that that engagement is authentic, not just lip service, not just crisis communications, but real, true leadership focused on engaging the people, because you can't turn an organization around without having the people on board. So I'm proud of what we've been able to accomplish so far.
One of the comments from the NDP was that we need to work together on this, and that, they didn't really want it to be publicly aired. Have they offered the Conservatives an opportunity to help select a new CEO? Have you been invited into some of those meetings and discussing this situation? Because they said, let's work together on this. So have they offered you that opportunity?
No. So Jim, I'll be honest. I became the MLA for Kelowna Mission, in which Kelowna General Hospital sits, on October 19th. The first time I asked for a briefing from Interior Health was in August of last year during the campaign. We subsequently asked for briefings and meetings repeatedly, and there were no meetings offered, no briefings offered, nothing. We ultimately toured Kelowna General Hospital at the invitation of ER doctors, not Interior Health. It took until about 6 weeks ago for us to finally have a meeting with Susan Brown. They gave us all of half an hour. We have reached out to the Minister of Health repeatedly. I have not heard back from the Minister of Health. During that meeting with Susan Brown, that was about 3.5 weeks ago, I asked the Chief of Staff to the Minister of Health to provide us with monthly briefings from Interior Health until such time as this crisis is resolved. It's been more than 3 weeks, and I'm still waiting for confirmation that those briefings will actually be made available. The Minister of Health showed up to Kelowna on Monday, did not reach out to local MLAs, did not reach out proactively to media. Most of us learned this is how it was happening via the rumor mill over the weekend. So do I believe that we should be working together on this? Absolutely. Do I believe that there is an earnest intent to actually work together collaboratively, to be open-minded, to break down that bunker, and to try to work together? So far, I haven't seen evidence of that. I'm very open to being convinced. I'm obviously very open to being part of a constructive solution here. That's what I want. I have a 4-year-old and a 7-year-old. I want to be able to depend on the healthcare system locally when my family needs it, and I want every other family here to be able to depend on the system. That is my priority, but I will keep on pushing until we get change.
So those words ring kind of hollow when they say, let's work together on this. And then I think they have to recognize that you were elected by the majority of voters here in the Okanagan Valley, and that's the three of you. And then so there should be some allowance or at least letting you know what the problem is so that you can work together on this. I mean, to me, those words ring really hollow, and lots of times they use those words to try and silence people, which is, not really productive as well, especially when doctors are speaking out. And I guess the big question I have, Susan Brown steps down. Does that now allow for conversations to get the pediatricians that have left the hospital to come back possibly?
I mean, Jim, it should. We're hearing talk still of hiring new pediatricians from elsewhere. And obviously, from my perspective, anything that gets that unit up and running is a step in the right direction. Right. But I still worry. We have 20 pediatricians in Kelowna who have declined to work at KGH. That's among the highest number of pediatricians per capita almost anywhere. But those folks have declined to work in the working conditions, in the culture that exists right now at KGH. And that to me is just really striking, not only in terms of the pediatric situation, but the situation more broadly. When we saw the Ministry and Interior Health continually talking about how we're going to hire more new doctors from elsewhere to come here, at the same time as we have doctors here who won't work in the system, the metaphor that I used is that it was like they were looking for new meat for the meat grinder. And what we really need to do is obviously improve retention and make sure that there is a healthy culture there that people want to work in, not one that people actively are trying to avoid working in, which is something I've heard from so many healthcare professionals. I have actually spoken with doctors who have chosen to literally live in Kelowna and work at other hospitals rather than work at KGH. So there has to be a culture turnaround there. And that starts at a leadership level.
Yeah, I know we're spending like $5 million right now to campaign or run social media ads down south into Washington and Oregon and that to try to get doctors and nurses to come here. And I think that money might be better spent to try and convince the doctors that are here, that know the system, that KGH is a good place to work, as opposed to spending that money there. And I talked to a travel nurse the other day, who's a Calgary nurse that actually is going to Seattle and work because it's more money. They make more money at it. And I said, what's the like the talk down there? Is anybody talking about coming here? She said, I mean, that's her small influence there. She said nobody's talking about it, but I mean, the money's a big difference down there.
Well, Jim, I mean, there's a couple of things. Obviously, there is a financial difference. People do respond to financial incentives. That's part of it. But people also want to work in a place that has a healthy culture where they don't feel morally and professionally compromised. And the reality is this: you can spend $5 million on advertising, but doctors talk, nurses talk, people talk. When there is a toxic culture, which that has been described to me as what's happening, when there is a toxic culture, all it takes is a Google search to discover it. All it takes is talking to a doctor, talking to a nurse, talking to somewhere in the system, and discovering, hey, I don't know if I want to work there. So as one pediatrician put it to me, you can't recruit into a toxic culture. So fix the culture, and that in itself will be an advertisement for working here. Who wouldn't want to live in Kelowna? It's the best place on earth. It's an amazing place to live, to raise a family. It's a great place to work. There are amazing people working in our healthcare system, but if that culture is broken and if that leadership is not listening, then that becomes a reason for folks to not want to work there. So we have to fix that, and that will be a better advertisement for working in Kelowna General Hospital or anywhere else in our healthcare system. That will have a much bigger impact than renting a coffee truck in Seattle and doing a bunch of performative BS, which seems more geared toward trying to fool British Columbians into the belief that this government is working towards solutions, when the reality is the problems are staring us all right in the face. We can see them with our own eyes. Stop trying to fool us. Fix the actual problems. Fix the culture. Value the people. Retain the people. And let's get healthcare working again.
Yeah, it seems like common sense. If I was a pediatrician working in Seattle, the first thing I would do was phone a pediatrician or send an email to a pediatrician here and say, hey, what's going on up there? Why do you guys lose that many pediatricians?
Exactly.
And then, they would probably, they'd be very candid with each other. And he'd say, okay.
But Jim, one of the things that really shocked me as I learned more about what's happening is the amount of pressure from the corporate side of the system telling doctors, telling nurses, telling frontline workers, don't speak out about what's happening here, because if you speak out, that'll make it harder for us to recruit. Well, that's BS. That's absolute BS. What are we doing? Trying to fool people into coming and working in our system? We shouldn't be doing that. We should be in a place where the people that work in our hospitals, that work in our healthcare system, are proud of working there, are excited to go to work every day, feel valued, and they're going to talk about that to other people who are considering working here. And that in itself will be the best recruitment drive you can ever see. So we need to turn things around so that that confidence and that trust is rebuilt, and that will be a major step in the right direction.
I think it all starts with trying to get these pediatricians to go back to the hospital, because that'll be a testament to that this system is fixing.
It's a huge signal, Jim. It's a huge signal, right? It's. I think one of the important things to recognize, and as I've dug deeper into the system, I've come to learn a lot about this. The situation with pediatrics is obviously a very high profile symbol of what is happening, but it's a system there, right? When you don't have that pediatric care, that adds pressure on the emergency room, that adds pressure on every other part of the hospital. You keep squeezing that balloon in one place, it gets bigger in another, then bigger in another, and eventually it pops. And the consequences of that in our healthcare system is that people get hurt and people die.
So what's next for the three of you in this area here to kind of keep pressure on to make sure something happens?
Yeah, we're going to continue our advocacy here in Kelowna and here in the Interior Health Catchment area. We're going to continue pushing to make sure that we get the right new leadership in place. We're going to continue to make sure that the people overseeing the hiring of that new leadership are actually listening and actually have an understanding that something needs to change rather than just perpetuating the status quo. So that's going to be a very important piece for us. And then we also are talking to our colleagues around the province who, inspired in part by what we've been doing here, MLAs all around the province have been hearing the stories of what's happening in their local hospitals. So you're going to hear those stories coming out from hospitals and healthcare systems all around the province, which show the need for change in our healthcare system at large.
One of the things I've noticed, and then we're going to switch gears a bit here, one of the things I've noticed recently is the Conservatives seem to have found their stride here. You were seeing like Eleanor Sturko, she's really working on the drug file there, and we're seeing with Bangu working on the BC Ferry file. And then also, I think you guys are starting to develop relationships with media when it was a confrontational kind of like relationship a lot of times, and I see that playing out to the betterment for British Columbians because we're challenging power, right? And I think you guys have found your stride in that in many areas. Any comments on that?
Yeah, thanks, Jim. Those are obviously, thank you. I appreciate those kind words. I think that we as a team really have been finding our stride. And I think that as you settle into the role of being an MLA, there's a few things that happen. One, of course, is that people do develop positive relationships with media and an understanding that media can't exist without the people through whom they tell stories. And as elected officials, media are a really important part of being able to amplify the messages that you're delivering, the stories that you're telling. In the case of this healthcare situation, the stories and warnings that we're trying to amplify from people in the system. So I think we are finding that relationship with media, and we're also establishing trust with stakeholders in the community. The kinds of stories that we've heard from people in the healthcare system are the kinds of stories that you only get if you establish credibility and trust with people to the extent where they feel as if you understand what they're talking about, that they can trust you. One of the things I've heard time and again is you can tell this story, but you can't use my name. So establishing that trust with stakeholders in the community, with whistleblowers in the system, and with media is a really important part of what we do as opposition, because our job is to speak truth to power, and our job is to push for better, and our job is to try to be constructive critics who are pointing to how things actually can be made better, who are trying to stop stupid when stupid is happening. And I think really importantly, our job is to continue to build ourselves into a credible government in waiting that people can have confidence is ready and equipped to form a new government for the people of British Columbia when that next election comes. Yeah, there's a lot of stuff at record highs, and we're seeing that, in
in housing affordability, we're seeing that in the economy, we're seeing that in jobs, and we're seeing that in healthcare, and we're seeing that in the homelessness and the opioid crisis, and we're seeing a lot of like pots on the stove kind of like bubbling over. And like I guess there's a lot of work to be done in British Columbia, and actually convincing people, and I don't want to go too far, I'll let you have one last comment here on like the economy in general here. How do we convince British Columbians or people to bring capital back here? And that's kind of your purview as well, because health really isn't in your wheelhouse, but you've taken this on because it's in our local backyard here. But yours is jobs and innovation and growth in that area.
Yeah, I mean, Jim, on that, I'm not our health critic. We have 3 great health critics in Anna Kindy, Brennan Day, and Claire Rattay, and they've been doing a fantastic job. Myself and my colleagues here have been taking the lead on the story in Kelowna General Hospital because it's a local story. But I would connect healthcare to the economy. When I talk to business leaders locally, one of the things that they know is very important is that for people to come here, to work here, to start businesses here, or anywhere else, they need to have confidence that there's a healthcare system that they can rely on. If you're going to move your family here, you want to know that there's a pediatric unit available for your kids if they need it. So not having a functioning healthcare system that you can rely on is actually a major issue for attracting talent from a business perspective. My critic portfolio is jobs, economic development, and innovation, JEDI. So I am primarily focused on the economy. And to your broader point, Jim, what I would say is that politics is downstream from culture. And right now, we seem to have a really broken culture economically in British Columbia, where we have almost difficulty or almost impossibility of getting things built on the land base. A generation of young people, the entrepreneurs and innovators and job creators that we're looking to create the next generation of jobs, those people are leaving, Jim. They're leaving or considering leaving. They're going to Alberta. They're going to Austin, Texas. They're going to Seattle. They're going to Dubai. They're going to places around the world where they feel they can have success, where success is celebrated and enterprise is encouraged, and there's a culture that truly venerates the entrepreneur and small business person that builds our economy. So I do think that we obviously need to make serious policy changes in order to get our economy back on track here in BC, but we also really just need a cultural moment. We need a leadership moment. We need to be able to convince business people, business leaders, investors, capital, entrepreneurs. We need to convince people that British Columbia is once again a place that they can get excited about, where the spirit of enterprise is there, where we want them to be here, we want them to build, we want them to succeed, and they don't have to jump through ideological hoops from a government that fundamentally doesn't actually understand business. So that to me really is the reset moment that we need as a province in order to reinvigorate our economy, get this province back on track, and frankly make sure we have the kind of healthy economy that can pay for childcare, that can pay for education, that can pay for all the things that we want and need and expect our government to deliver on.
I do thank you for your time. I appreciate it as always. You always make yourself available, and we've reached out many times to Susan Brown for an interview. And then we've also reached out to Josie Osborne as well as many as other, we would like to interview them as well. But you've always made yourself available, which is great, and we really appreciate that. And we also thank you for watching Kelowna Now.
We don't just report the news, we live here too. We're your neighbors, bringing you stories that matter to all of us. No government funding, no outside.